I didn't particularly think it was ADHD. I just thought the rest of the world were looking at things differently to me. But my deputy manager in work said, look, we're tired of telling you off. We know that you're very, very committed to work, and we know that you stay late, and you do everything that you should do, but you also say the wrong thing, do the wrong thing. And it's like as though you've got some kind of impulsivity and you're just not on the same page as everyone else.
A number of years ago, some consultants came to us and said about setting up a LEAP review service, which is a ADHD review assessment clinic in primary care. A number of us GPs on the Wirral trained and become capable in assessing patients who have ADHD and managing them every 6 months and taking them off the sort of secondary care list to improve the waiting list time. Our pathway now, what we're looking at is trying to move that diagnosis into primary care. Patients still get referred, but if they feel that their needs get met within primary care, we can assess them in primary care and give them that diagnosis a lot quicker, start them on treatment quicker, and hopefully they'll get better quicker. We've been quite fortunate that we've had good relationships with QbTech in terms of setting up this pilot, and we've been able to establish and have our own QbTest machine, which is the first one in the country within our practice. And it helps that the patients know they're going to get an extra sort of level of investigation when they're coming to get that assessment. There's a trained administrator here who can do the QbTest and puts the patients in a relaxing environment to make sure they're comfortable and they understand what the test is. When I see the patient straight afterwards, when they've had the QbTest, I can go through those results with them. I can give them a visual image of what their symptoms are displaying on the screen and how it meets those symptoms of ADHD. And it's that instant feedback that they get, and they find it rewarding in terms of seeing that potentially they are different, and this is explaining why. It's not a full investigation to clarify the diagnosis, but it is a very good supporting aid, and we use that in conjunction with screening questionnaires and the history and examination, and patients find it very useful.
This model wouldn't work without QB, the testing and the kit that provides within primary care. Knowing that we're the first primary care GP practice and primary care setting to have this kit, to have the ability to use the testing equipment to assess individuals. QB testing is in the NICE guidelines around understanding and assessing ADHD, and it's a national standard in that respect. So the fact that we can manage that entirely within primary care, and they will never have to touch on the very precious secondary care service other than clinical oversight. I think that's probably what makes it, in essence, the ability to be able to cut down waiting times.
Having that access to bringing in all those skills from primary care, marrying up that secondary care to open up that access to patients, I think is a really exciting initiative, and I think it's a really good example that it can be done. But what is great about what's happening with the Wirral team is that they have those same constraints as everywhere else, but they have decided to really take a different approach. And obviously the pilot that's happened so far has been very positive, the impact on the waiting list, the access to patients, and so much so, and looking to expand that to other PCNs across Wirral, I think, again, will be a real good benchmark for what other people can do up and down the country.